Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello and welcome to this latest episode of Podcast. My name's Fern Jackson and I'm from the marketing department at Practice Plan. And today I'm joined with one of our regional support managers, Donna Hall.
Hi. Hi, I'm Donna. I cover the East and West Midlands for Practice Plan and I've been with us for just over 10 years.
So today we're going to talk about the difference between your plan members, your existing pay-as-you-go members, and also about attracting new patients to the plan.
Okay.
So given the current dental landscape and the financial climate, let's start with how do you communicate the benefits of plan membership to existing pay-as-you-go patients?
Okay, so your long-standing pay-as-you-go patients will have been coming to you for a long time. They'll have proven they're loyal. They'll attend fairly regularly, although you'll usually find it's about every 7 to 9 months as opposed to every 6. So the membership gives you a great way of getting them not only to attend more regularly, but of course giving them all the extra benefits that as a non-member, they're not entitled to. Things like the worldwide assistance, your discount off your treatments, your reduced emergencies, etc. When talking to a long-standing pay-as-you-go patient, your messaging can be a little bit different to how you would word it with a new patient. So for me, I would be talking to your long-standing patients about the fact that, have they considered joining the membership? They may have been asked before, or you may have asked them many years ago and then not re-asked them because they said no once and then we've never asked them again. I think you should be asking your pay-as-you-go patients every 12 to 18 months roughly.
Okay.
But making a note when you've asked them on your software so that you're not asking them every time they walk in the door, because that then can feel quite repetitive. With a long-standing patient, little phrases like, you do realise you're paying us more than you need to for dental care. Do you realise you could save money if you're a part of our membership? Showing them the savings they could get on their treatment if you're using a maintenance model of plan. The fact that, as say, you may do reduced or free emergencies for members, did they know all those benefits were available? And actually, would they benefit from being on a membership if they're already regularly attending, to keep that regular attendance going for them, but also to keep them dentally fit? And also, of course, also thinking with your pay-as-you-go patients, not only does it get them to attend more regularly, more like that 6 monthly attendance that you'd like from them, they're more open to other treatments that you sell because of that regular attendance and, of course, feeling more part and parcel of the practice and what you offer.
So is that the same then for new patients or?
No, I wouldn't approach it in the same way with a new patient, because what you don't have with a new patient is any idea of what loyalty they're going to give you long term. So the challenge with a new patient is if you solely focus on the discount on the treatment, which might feel like the quick win and it might feel like the obvious reason a patient would join a plan is to save X amount on the treatment today, your challenge you have is unless they know all of the benefits of the plan, they're likely to have treatment and cancel.
Right.
And then you've got them on the plan, they've had the discount and then they've come back off. So the best way to approach it with new patients is to simply use the health message. So Donna, the best way I can keep you healthy is for you to become a member of the practice. That means I'm going to see you regularly, I can spot problems, we can reduce invasive treatment long term. You're also going to get a range of other benefits with us for being a member. And then it's important that you prescribe which level of plan you feel is right for the patient. The patient shouldn't be choosing off a menu of options. You should be having a clinical discussion that says, Donna, based on what I've seen today and based on your oral health, the membership level for you would be, and then you discuss which membership level. That way, you've got patients joining for the right reasons, and although they get all the other benefits straight away, it means that, they realise there's a long-term health implication of being a member.
And what concerns do you find patients typically have then about joining the plan? Is it a lot of it to do with cost? Or?
It can be cost. It can be if the plan's not explained properly to a patient, they might feel they're being sold something, you know, especially if you leave the sale of the plan to your reception or front desk team. For me, it has to come from a clinician. It has to be the dentist that's saying, Donna, that, you know, the best way I can look after you is to be a member of the practice. By all means, then you hand back to your front desk and they can talk about all of the additional benefits.
Right.
But what you don't want the patient to feel is that you're trying to sell them something, or if they don't understand how the costings work, they may feel that, oh, am I going to pay more for this membership? Am I paying more to get these extra benefits, which is often not the case with a membership. It's usually the same price or slightly cheaper. So, you know, objections you sometimes get, you know, other than, I say, not understanding what they're being asked to join, might be that they have their own insurance, their own health insurance. For any patient who does have their own health insurance, my advice is always ask them to check with their health provider as to whether they can join a membership and explain that they'd like to join a dental membership. Is that okay? Because there's an impact on them claiming money back. It may be that they're nervous patients and actually they're new to the practice. They don't know at that point if they like you, if they're going to want to stay. You know, sometimes it takes a little bit more time to build that relationship with those patients. So you may want to re-ask them again a little bit later into their journey. It can be cost. So having a range of plans is important, you know, where you're thinking about not only what do they need for their oral health, but also what do they need to budget for as a minimum. So lots of practices have, say, a 2 exam only model, which just gives the patients an entry point, and it gives them, a low level plan to keep their place with you, to see the same dentist and all the other benefits. And then you've got patients who don't like direct debits, of course. So they don't want to pay a monthly outgoing. However, did you know they can pay for the whole year in one go? And actually, patients really like that ability.
Yeah.
So they just do a one payment per year and it covers them for the whole year.
Okay. Oh, it's okay. There's lots of options then.
Yeah.
So you mentioned you suggest that the clinician actually mentions it first.
Yes.
So I suppose the patient journey does come into it.
It does.
Is that something that practices should be looking at? Maybe?
Absolutely. Yeah. So I think it should always be the dentist that has the clinical discussion with the patient about the membership and which level is right for them. However, you need to mention the plan far earlier in the patient journey than when they get into the chair. So that's every new inquiry on the phone. It's mentioning we do have a practice membership. Remember that you're not promoting practice plan, you're promoting your own brand. You know, this is your dental practice, it's your membership. So it's talking about, you know, we have a way of budgeting for your routine care. When you come in for that first appointment, Dr. X will speak to you about that membership in more detail. It's having maybe PDFs of your literature or having something on your website that if you do send any kind of follow-up to new patients, you can include information about the plan. It's having printed literature in the practice and having something that patients can have a look at, a tangible leaflet they can hold while they're there to read all of the benefits before they see the dentist. And then when they come back out their appointment, they're back at reception, and that's where then the front desk team will try and close that sale for the dentist.
There's a lot of different resources that the practice can use.
There is, absolutely.
And then how would you suggest that a practice sort of keeps the plan membership alive and sort of a focus for the team in the practice?
So what I will always say to practices is this is not something that you just do for a few weeks and then we forget about it because we're on to the next new thing. You know, membership has to be embedded within every member of your team. You should be able to stop any of your nurses in the corridor, your front desk team, any of your clinicians, say, tell me about your plan. Tell me what the benefits are to our patients of being a member. The more that you eat, sleep, breathe it within the practice, the more it will become part of the culture of your practice. You'll then find that you have patients ringing saying, oh, my friend's a patient with you, they're on your membership, can I join? So it starts to get that word of mouth that you're offering a membership and it's offered to everyone in the practice.
Brilliant. Well, there's lots of good advice in there and that practices can start implementing. And is there anything else that you'd like to share?
No, I think that's covered what we needed to today. Thank you.
Thank you, Donna.